10% of all residents have died. There was conflicting information at the start of this epidemic. Should they be sent back to care homes without testing? Should they not? We saw what happened. We've also heard from Matt Hancock. He said that care homes are the responsibility of local government. What do you say to those who suggest that you are washing your hands of those who need us the most?
Well, I would be appalled if people thought that. I think it's the responsibility of government to work as hard as possible to improve the situation, and indeed to make it very clear that when things aren't going as well as they should, we need to do better. And on care homes, I think that is very clear. I mean, I've looked again at what happened back in February and March, and whilst now is not the time to go through the tea leaves and work out precisely what had happened then, I think it's clear that care homes themselves were taking measures to stop visitors coming in. I think the admissions back from hospital are a very important point, and from the evidence that I'm seeing, the rate of admission back from hospital actually was declining from its January height, and that only 5% of those being admitted to care homes were new admissions. That clearly, is an important factor here when considering the overall impact upon our care homes. But, I listen to people, I listen to local providers as well, and clearly there were huge issues, and we've seen a great tragedy in our care homes, which is a matter of huge regret. But I'm glad to note that in the last 2 weeks, we've now started to see a decline in the rate, which is encouraging, but there's more to do.
Nevertheless, 40% of all deaths are in care homes. What mistakes did you make?
Well, I think we rightly emphasise the importance of making sure that our NHS services and our hospitals were places that could continue to admit patients and wouldn't be incubators of the disease. We achieved that. We protected our NHS, we ramped up our capability, which meant that it didn't, thankfully, fall over at a time of huge pressure, and tribute has got to be paid to everybody who made that effort. And also in what we've done with testing, there are lots of achievements here that we need to note.
We'll come to testing if we may. I'm still on care homes at the moment, and then we'll rattle through. So you're saying that you focused, in your opinion, quite rightly on the National Health Service to the detriment of care homes.
Well, look, I think we needed to make a choice about testing, and we did decide to focus upon the NHS. I think the issue with care homes is that we've got many thousands of different providers, different settings. There have been lots of examples of care homes that have mercifully stayed infection-free, but sadly, far too many cases of infection and then death. I think that every country in the world will look back and say there are things we could have done differently.
OK, but it was government policy to focus on the National Health Service. I'm not saying it's right or wrong. I'm asking what the policy was. It was to focus on the National Health Service first and foremost.
Well, that's right, and I think that was absolutely essential. And now is not the time to blame people. I think that would be wholly counterproductive. We've got to work together, not just with the care home sector, but with our scientists, with all the people who advise government, and together come to sensible solutions.
OK, so that was the decision that was made. 40% of people who've died are in care homes as a result. As we said yesterday, the judicial inquiry will no doubt be looking at that in more detail. Another group twice as vulnerable as the average are diabetics. Given that we've learned what we've learned from what happened with care homes, what are we doing to wrap cotton wool around people who are twice as vulnerable, like diabetics?
Well, Okay, I think one of the important points you've just illustrated there is our evolving knowledge about the nature of this disease. So you've seen the change in the recognised symptoms list that we announced this week, and we're seeing more and more learning about how it can affect people who are perhaps obese, certain types of person, perhaps certain ethnicities who are more vulnerable. We're learning all the time about this disease. You know, the knowledge that we had back in March when we were making the decisions, and we've talked about care homes, wasn't as developed as the knowledge we have now. And of course that knowledge will continue to develop. So I think it's important that we focus upon groups. We are absolutely unafraid to identify new vulnerabilities and then to take action. And as the science emerges on diabetes, on obesity, then we will take the appropriate steps to protect people.
Are there other groups within that we should also be looking at? Diabetics, obese, clinically obese, BAME, of course. Any other groups?
OK, look, I'm not going to stand here and say we've got a definitive list. There may well be emerging science about other types of vulnerability that we need to address very quickly. But, you know, like all countries in the world, we are still learning about this virus. And that means that this isn't a fixed sort of set of facts or circumstances. This is an evolving position. And the government's had to sort of evolve and change and develop its policy in accordance with that, which is why it is very difficult now in late May to make definitive judgments about decisions made in March. The position and our knowledge was very different then to what it is now. And no doubt our knowledge will be even more developed come June and July.
You've become a bit of a hostage to fortune, the government, on setting dates that you then can't reach. Is the 1st of June for getting schools back another one of those? Because it certainly looks increasingly as though it is.
Well, look, I think we were right to set dates. We were being criticised because we weren't doing that. You know, people said, well, what's the roadmap? You know, we haven't got a clue about how to plan. And I think it was right that we set that date. We always said that the 1st of June was conditional, not just on the R rate, but on the need to make places of work safe. I'm hearing what's being said by a range of different employers and representatives of our brilliant teachers who already are working with key workers, families and vulnerable children to provide education services. Let's not forget that. And I think as the picture emerges, we've seen the BMA's really helpful advice this morning. You know, bit by bit, I think we're seeing a position emerging where if it is safe and if people feel safe to be able to work in those environments, then that can happen from June. But I accept the picture is a mixed one at the moment. The conversations continue. I know my colleague, the Secretary of State for Education, is talking and working actively with representative groups. We've got to keep that going, and hopefully by the 1st of June, we will see a range of different establishments opening for those vital year groups that need education and need it now.
But you acknowledge that it might, given what we've seen with the pushback from the teaching unions and also local councils, it might not be as many as you had previously hoped.
Well, we've got to accept the fact that you know, some of the councils, of course, are employers. Decisions have to be made collectively. There will be other institutions that feel it is safe to open up, and we should respect that as well. I think you know, this is a developing picture. 10 days to go. It's not a long time, I accept, but I'm encouraged by the conversations that I'm hearing. Only this morning I had a contact from a nursery provider who feels that they are ready and have worked with staff in order to provide a safe setting, and in fact have been caring for very young children throughout this crisis. So there will be plenty of examples where people feel they're able to do that, but I utterly respect the views of those who want to exercise greater caution, which is why we've got to keep the dialogue going.
OK, given that you say that the government should set dates, set targets, where are we on contact tracing programmes? When might we see those fully operational?
I think the aim had been to get those programmes going by the end of the month, and we've already seen you know, a big recruitment drive on. We've now got, I think, 21,000 volunteers to do the contact trace programme. This will be a mixed programme. It'll involve individual tracers actually working with the community, and then of course we're piloting that app in the Isle of Wight. That's still work in progress. I think the aim is, Kay, to get things moving as quickly as possible. I'm confident that with the recruitments that we've made, we can get on with that over the next few weeks and then see that particular programme increase in its size and potency, which will help us hugely.
But, Justice Secretary, you said that you like dates. They are targets that we should aim towards. What date are we looking at for the contact tracing programme to be fully operational?
Well, I think the plan had been to get things moving by the end of the month. I think it will be a developing picture. I think we will see it gradually increase in its potency and range, particularly with the introduction of any electronic, digital mechanisms as well. But from what I'm seeing, the progress is really encouraging. We can't let up on this. This is urgent and important work. And from everything that I've seen, I'm confident that we will get this up and running very, very soon.
OK, so let's say by the middle of June, contact tracing, all being well, will be fully functional here in the United Kingdom.
Well, the aim is, of course, to do it as soon as possible, and June is going to be an important month.
So I'm giving you some leeway there. I'm saying in a month's time, will it be fully operational?
Well, OK, I don't know fully the picture with regard to the development of the pilot. What I do know is that I think we'll see a position which will quickly enlarge and improve over the next few weeks. And I very much hope that June will be the time that we see that key change and that spread of this system, this mechanism throughout our community.
So how disappointed will you be if it's not fully operational by the middle of June, say?
Well, look, I think I'll be frustrated and disappointed if we don't make the progress that we want to make over the next few weeks. It's been a time when I've been surprised and pleased by the developments that we've made. I think you might remember I was a little bit pessimistic about whether we'd make that 100,000 testing target by the end of May, but I was proved wrong. I'm glad that I was proved wrong, and I'm sure that I'll be proved wrong again on many occasions throughout this fast developing crisis. I don't have the powers of clairvoyance that some people would like me to have.
No,
this
but you
is a
said
constantly
dates,
evolving
so I was just
situation.
picking you
do
up
my
on the
best
dates,
to.
Justice Secretary, because you said dates, so I was just challenging you on the dates because you said that they were important. That's why I was asking you for dates for contact tracing. Two very quick questions, because I know you have to go. So two very quick questions before I let you go. The slogan. First of all, it was stay at home, then it was stay alert. Now we've changed it again to keep our distance, wash our hands, think of others, play our part. Did we not like the stay alert one?
Well, no, Stay Alert's still very much part of what it's all about. I think what we're trying to do is explain underneath that general direction what that means. And, of course, the different elements of staying alert, which include washing hands, keeping our distance, build up to that general approach, which is that we all must be very much aware not only of each other, but what we can do in order to minimise the inadvertent transmission of this terrible disease.
Yeah, Stay Alert didn't work quite as well, though, did it, as Stay at Home?
Well, I think Stay at Home had the clarity and simplicity of a direct sort of instruction. This was always going to be a more difficult moment when we had to give more nuanced messages and to encourage everybody to take those small steps out of the full lockdown. Going to be a tough ask, okay? Very difficult time for everybody, and government doesn't pretend that anything otherwise. But we've got to keep on developing those messages, and that's why you're hearing that sort of detail.
And before you flee, some suggestions that we should have an extra bank holiday in October. Let's be honest, we all need one. What do you think?
Well, I've heard that suggestion. I mean, I don't know how active the consideration is of it. I think that by the time we get to October, I think the challenge for us all would be how to make sure that we can get back to a position, particularly with public services and the economy, to get it as fully active as possible. I mean, I'm all for bank holidays. I'm all for making sure that we can recharge our batteries, but the challenge might be a somewhat more fundamental one about us getting back to a state of full activity as quickly and as safely as possible.
OK, we could chat for another half an hour, but I know that would be greedy because lots of other people want to talk to you, so I must let you go. Thank you.
Thank you, Kay.